Providence Sacred Heart Medical Center announcing it is halting all non-emergency surgeries starting tomorrow.
This affects Sacred Heart, Holy Family, and the non-emergency outpatient surgeries and procedures at the doctor's building on the Providence campus. The hospital says it will work with patients on a case-by-case basis to reschedule and provide necessary care. And they encourage patients with surgery scheduled for the next 2 weeks to please contact your doctor. Providence does not know, they say, how long this pause will last.
The hospital says this move is a direct result of the number of people hospitalized right now with COVID-19 and the staffing shortages they are experiencing. They are urging everyone to please get vaccinated.
And just because a surgery is classified as non-emergency, it does not mean it's a minor operation.
Yeah, we're bringing in Ian Smay now to talk a little bit about a man that you spoke with today who's actually having a major surgery that's having to be postponed.
Yeah, so Larry Knight is an Air Force veteran who was scheduled to undergo the first of 3 procedures in getting his colon removed. But due to the surge in coronavirus cases that we're seeing now, he now has to wait until at least October. And as he told me earlier today, it's not only having a negative impact on his life, but it's also causing difficulties for his wife and kids. Larry Knight lives in Medical Lake with his wife and 3 kids after spending 10 years in the United States Air Force. He had to leave due to medical reasons, and he now spends most of his time at home.
Yeah, it's extremely frustrating, and it's almost like a gut punch. This is drastically affecting my life. I'm pretty well stuck just in town due to having to be so close to a bathroom all the time.
Larry suffers from ulcerative colitis and isn't responding to medication. Because of this, he needs to get his colon removed, which will take 3 separate surgeries. He was scheduled to have the first procedure done at Providence's Holy Family Hospital on September 24th. But then he got a heart-crushing phone call.
Extremely frustrating. I'll put it very mildly, yes. I was extremely pissed off.
The hospital told Larry his first operation would be postponed until at least October 15th. Until then, he's dealing with pain and taking medication that makes him immunocompromised. He and his wife are fully vaccinated, and he's had a booster. Their 3 kids are in school, and now the family has to worry about Larry possibly getting COVID while he awaits surgery.
My oldest son has been saying, too, that he's concerned about catching it as well and bringing it home, and so has my daughter in middle school, too. So it feels like we're all kind of walking on eggshells because we don't know what's going to happen.
The worry doesn't end at the first procedure either. Larry says they also have to worry about illness between the 3 procedures. The whole process until full recovery will take about a year. Until the current coronavirus spike dies down and Larry can get in for his surgeries, his life is on hold, as are his family's.
My wife's having to do all the stuff I would normally do, grocery runs, just little outs. We've got 3 kids, so she's got to worry about busing them everywhere too, and she works over at Hallett as well, so she's got to balance between that and having to get everything done.
My goodness. So we often report on the numbers, but it's certainly interesting to hear the personal stories behind these surgeries, delays, and cancellations.
Obviously really stressful for them, but scary because now they're just kind of in limbo.
Yeah, and I mean, hopefully we can start getting through this spike of coronavirus cases, because that's what it's going to take for surgeries to restart, and people like Larry can get the help they need.
All right, Ian, thank you very much.